thank you for your patience. Now it's time for the address by our chief guest. And Dr. Paul, thank you very much for joining us. We wish you were with us physically, but we appreciate your time given your compulsions. I've had the good fortune of working with Dr. Paul very closely during my healthcare days, and his dynamism is absolutely inspirational. All I can tell you is I don't know what he'll speak on, but whatever he will commit, you'll find that will happen. So Dr. Paul served on the faculty of Department of Pediatrics, All India Institute of Medical Sciences for over 35 years. Over that 10 years, he was the department head. He's globally recognized as a medical scientist and a public health exponent. The Government of India appointed Dr. Paul as a member of the NITI Aayog in 2017, where he leads the health, nutrition, and education verticals. He has played a pivotal role in formulating the Ayushman Bharat PMJ scheme, the Ayushman Arogya Mandir scheme, and the Poshan Abhiyan. Professor Paul also served as the chairman of the Board of Governors in supersession of the Medical Council of India in 2018-20, and under his tenure, we saw what is much needed, the appreciable increase in number of undergraduate and postgraduate medical seats, and the introduction of telemedicine guidelines. He's been a strong proponent of telemedicine for a long time. Dr. Paul was at the forefront of the COVID war that India fought as part of the Union government. He chaired the National Task Force on COVID-19, the Empowered Group on Emergency Management Plan and Strategy, the Empowered Group on Vaccination, as well as the National Expert Group on Vaccine Administration for COVID-19. Dr. Paul has over 400 scientific publications and an H-index of 62 is credit. He featured among the world's top 2% scientists in the field of pediatrics, according to a study conducted at Stanford University in 2020. He's a fellow of all 3 science academies of the country and a recipient of the prestigious preeminent Dr. B.R. Ambedkar Centenary Award for Excellence in Biomedical Research by ICMR. He was also conferred the prestigious Eisen Dogramaki Family Health Foundation Prize by WHO at the 2018 World Health Assembly for his globally recognized service in the field of family health. Dr. Paul, we are really, really lucky to have you with us. May I please request you to address us. Thank you very much, sir.
Thank you very much indeed. Thank you. Good afternoon. Distinguished leadership of Association of Senior Living India, distinguished participants of the annual Aging Fest, friends, first and foremost, my apologies for having missed my previous time slot, or previous appointment with you for some reason beyond my control. But I'm so happy that you have been kind enough to carve out, this brief slot for me just before lunch, and I'm so honored and so privileged and really grateful for this opportunity to speak to you. I first and foremost would like to compliment you, congratulate you all for a pioneering work that ASLI has been carrying out consistently, nationally, and in a comprehensive way. You have given the lead in this important and emergent area. In some sense, the priority for the care of the elderly, the welfare, empowerment, and care of the elderly was always an agenda, but in more recent times, this has gathered pace, and thanks to pioneering work and pioneers like yourselves, who have seen the future earlier than perhaps many other stakeholders. I add my voice of appreciation, my voice of partnership, and my voice of collaboration with your team, your fraternity, your leadership, and indeed all the stakeholders that are present in the hall this afternoon. Great work being done, and we would like to see much more space, much more work in this very critical area, gathering pace in all parts of our great nation. The reason for this is obvious, and I'm sure that has been communicated and mentioned here, that we always had a proportion of our population, senior people who need special care, special touch, special measures, and a comprehensive societal response, including government response. But then this has become even more important because of the rising trend because of the changing dynamics of our family system, and above all, the dynamics of our journey toward Viksit Bharat that we will experience, which will bring opportunity, which will bring more resources, but also challenges, because we need productive workforce and we need to look after our elderly. So you are in the right space, ahead of your time, but surely at the absolute most important phase of this journey, because this is a time when there is a very active policy, debate, discussion, and discourse in the company. And the question that has been asked for this fest is senior care in India ready to take off? Is a pointer toward your concern, but it's also a simple answer. The point is that senior care in India has always been, a system, always been an endeavor of our society. But yes, in changing scenario, to which I briefly referred, there is a need to put in more energy, more comprehensiveness, more integration, and bringing with more resources, more participation, and that moment has indeed definitely arrived. I think this, I like to justify that first and foremost, with the very major development in the space of health protection, financial protection for health. The Union government, under the leadership of the Honorable Prime Minister, has included all senior citizens above 70 years of age as beneficiaries of Pradhan Mantri Jan Arogya Yojana, the Ayushman Bharat PMJ mission, which is, as you know, is a benefit without any reference to the socio-economic status, the income levels, and so on and so forth. For this age, this benefit and this coverage is truly universal. It will benefit 4.5 crore families and 6 crore individuals. 6 crore individuals are today across the nation, through a cutoff of age, are now beneficiaries of assured care across 1900 plus packages in 30,000 hospitals without any out-of-pocket expenditure and in a cashless manner. And of course, we hope that there will be fast-track care and friendly care for this very special segment of our society, our citizens. I'd like to salute the contribution of senior citizens. They have lent their effort, time, productivity, made sacrifices to take our society where we are today, take our nation where we are today, take our children and the youth where they are today, and they are ready to take off to a totally new level of achievements as we go forward. So this is also a day when we would like to salute the senior citizenry of our great nation. So it's more than 70 years. Health insurance coverage is something I hope the Aging Fest of 2024 will celebrate in a very, very big way. We will need help of organizations like yours to reach out to all the beneficiaries. We don't want to leave, we cannot afford to leave anyone behind. And many of our senior citizens will be in, shall we say, difficult locations, remote places, urban areas, rural areas. They could be left out, even when they are not far away from major hubs of governance or major hubs of hospitals, because we need, they are, the pathways have to be created to reach them, and of course, we have a large geography and so on and so forth. So clearly, it is an opportunity for you to contribute toward creating the special card, the golden card of PMJ for all the citizens, and of course help us refine and strengthen the existing system of PMJ, especially to the needs of the senior citizen beneficiaries. The second reason why I say that this is indeed a special moment, and this year is special because clearly there are multiple policy discussions and discourses that have been initiated. You are aware, and I can speak for my institution, the NITI Aayog. You are aware of a very, actually, it's a very comprehensive and forward-looking report that came from the NITI Aayog, the senior care reforms, which focused on social welfare, economic welfare, digital inclusion, and healthcare, which also has now paved the way for us to develop a much more comprehensive senior care and senior citizen welfare recommendations for the national government. You may be aware that our comprehensive group is looking at it. Many of you in the room are perhaps part of it. Indeed, ASLI is part of it, where there are discussions. We are looking at where we are with regard to the welfare of senior citizens and the care and healthcare, nutrition care, and so on. We look forward to learning from the group to be able to craft new ideas on how senior care can be taken forward in every aspect. Practically every aspect is on the table, as you know, but also, therefore, it is time for your organization, as well as those of us who are concerned with this important priority of our nation, to offer ideas on every aspect. Care economy, utilizing the talent of the senior citizens when they are active and capable. I like to call them urjavan, elderly, जिनके पास ताकत है वो contribute कर सकते हैं. एक particular date को contribution बंद नहीं हो सकता. How can that energy be harnessed for the societal goals, especially through our journey during the Amrit Kaal? What role can they play in improving, shall we say, education of children, welfare of children, preparing the youth for better productivity, and of course sector-specific input that the senior citizens can bring. At the same time, we would like to learn from you how to fashion welfare, social security, physical security, using technology for improved well-being and welfare and care of our citizens, and so on and so forth, and how to really prepare the society for an emerging paradigm of care of the elderly. India's model for senior care should be embedded in our cultural roots, should be embedded in family-centered care. We should bring back those elements which we may have been diluting in recent times. We need a societal response from our communities to be responsible toward the care of senior citizens, as we have done as a society for thousands of years. And to be able to adapt that to today's stresses and needs and the changes that have occurred in our system. Yes, of course, there will be need for institutional care and support. That would be needed, no doubt. But as much as possible, can we make efforts? Can we create a buzz? Can we create a movement that the elderly are really, truly are looked after by the families, and we enable the families to do so. We enable, small families to do so. We enable the young couple engaged in full-time work to be able to look after the elderly in the family. I think that is the kind of model that we should really be looking forward. And as I said, that debate within NITI is focusing on several areas. There are some areas which need a larger discussion. And as you also know that, is it ready to take off? Senior care is ready to take off. Also emerges from the fact that you see so much of more press coverage of this aspect, and the editorial space that has been devoted to this aspect in more recent time. So clearly, there is a paradigm shift in 2024, and the expectations from the government, and not just the government, from organizations like yours and other stakeholders, are now higher than ever. But above all, I would say, coming from NITI, my request to you, all of you, is please offer your ideas. Help us craft, a policy and an action which is embedded in our societal values, and also it is affordable, it is humane, it is as much as possible home-based, and of course it takes care of those who need more health care, more institutional care, should also be part of it. We have to safeguard our identity from physical security point of view, digital security point of view, indeed also financial security point of view, and the ideas on each one of them are truly important. The short point, yes, this has been a watershed time in terms of our efforts for senior care. The PMJ incorporation of more than 78 senior citizens is a watershed moment in its own way. We would like to see it implemented successfully, and also it's a time for us to craft a comprehensive, multi-sectoral, culturally driven senior care paradigm for our nation. With these words, I am grateful for the opportunity, and I look forward to continued engagement with your organization, but also with a larger group of stakeholders to take the task that NITI has taken upon itself on comprehensive senior care and senior citizen welfare. Thank you very much. Okay.
Dr. Paul, thank you very much for your time. Thank you very much for your encouraging words. We will continue to engage with you from ASLI with specific ideas and actions so we can take forward the agenda of senior care. Thank you very much, sir.